Breast Cancer Awareness Month is right around the corner. 1 in 8 women will be diagnosed with breast cancer in her lifetime. And while breast cancer is not preventable, it is almost 100% curable if detected early, which is why annual screening mammograms are vital for every woman over 40. Early detection is key for saving more lives. And here to tell us more is Dr. Anjali Malik, a radiologist at Washington Radiology. So welcome.
Hello.
Yeah, we were just talking about this during the commercial break, why it's so important to get checked. And, you know, you can't emphasize enough that early detection is the key.
Absolutely, 100%. The goal of annual screening mammography is early detection, because the smaller that we're able to detect breast cancers, the more treatment options that there are, and the better survivability.
And that's what we want. We want to put an end to this, and we want people to survive. And it can be scary. I know my first time, I had to go back and have a second scan done because it was my first time, and the doctors needed something to compare it to. And I think it's very important that doctors also explain that process as well, so you don't get scared.
I 100% agree. We try to inform all our patients that baseline mammograms are more common to have callbacks, but the good news is that 90% of women who get an annual mammogram actually do not get called back. And of those 10% of women who do need repeat imaging, most of them go on not to need any further testing and not having cancer. So it's just clearing up areas of concern.
So most women start with the mammographies at about age 40. Is there a reason why a woman would want to start earlier than age 40 getting checked?
So starting with why we would start at 40 is because 1 in 6 breast cancers are diagnosed in women ages 40 to 49. So the studies and statistics show that it makes sense to be starting at that age range annually. But when it comes to someone younger than the age of 40, you want to be looking at your family history. If you have family history of someone being diagnosed before the age of 50, of course, if you have a known genetic mutation, these are conversations you want to be having with your physician so that you can make the screening protocol that works for you.
Now, what do you say about the 3D testing? Technology is always advancing. What do you say? Is it worth spending the extra money and doing the 3D mammography, or are you okay with the two-dimensional?
We know that 3D mammography is the superior test. It has improved detection of small invasive cancers, so again, better early detection. And it actually reduces the so-called false positives. So those callbacks, like the one that you had, can be decreased. The reason is, rather than a standard 2D mammogram, which is like trying to read a closed book, the 3D mammography actually spreads the pages out. So when you're looking at the breast or the book page by page, you're actually able to look at it in better detail. So better detection and decreased false positives.
So let me ask you this. What about mammographies for men? Because that's something that, you know, I get it. You know, as a man, look, you never want cancer, no matter if you're male, female, or whatever. You never want cancer, but I think that it's hard for a man to say, hey, look, I need to get checked. Is there something that a man should look for? You know, like we always say to women, check yourself in the shower, make sure you're doing your own checkups. What do you say to men?
So a couple of things. It's a great point, and men absolutely can get breast cancer. And no, they don't need to be getting regular screening mammograms. But if there is any concern, whether it's a lump, an area of pain, any changes to that area, they need to talk to their doctor, and probably they are looking at getting a mammogram at that point. Now, for example, with Beyonce's dad, we know men can get breast cancer, and there is probably a known genetic mutation there that warrants testing. And so again, always important for patients to know their family history.
Whether you're male or female.
Exactly. And it's important for women to know their mother's side of the family history as well as their father's side, because breast cancer is impacted by both.
Wow. Is there an increase in men coming forward with breast cancer? Have you heard about that?
I haven't seen any increased statistics. It's still quite low overall, but we do see it. And men can develop increase in normal male breast tissue. So that's called gynecomastia, and we do see a lot of that. So majority of the lumps and areas of pain that we see when men come in to see us are that, but never discount it. Always get it checked out.
All right, Dr. Malik, where do we find you for more information? Because you've got a lot of good stuff here, and you do make it sound easy, you know, to go in and get checked. It's really not that hard. You just go in, take clothes off. It's easy.
So
you do that at home every night anyway, right?
Right. So I'm a breast imaging radiologist at Washington Radiology. You can check us out on Instagram at Wash Radiology, at Solus Mammography, or you can find me directly at Anjali Malik MD on Instagram and Twitter.
All right. Thank you so much for coming in.
Thank you.
A lot of good information. All right. Stay with us, folks. We have more of Let's Talk Live coming up right after the break.